when I go into a home to serve these patients, I do baths, shampoos, linen changes. And I always try to go in with a smile because these patients are dealing with enough without me going in with a frowny face.
She comes in with a big smile, and the world just changes when Margaret comes in. Sometimes she'll have a red nose on and say, "Old nose is here," and she just, if we're kind of low, Margaret picks us up, and it's another world when she leaves. And Vic just been here one step ahead of me. Before the problem would arise, Hospice has been on top of it.
Well, my aunt was Margaret Cowell, and her son Peter Cowell had cancer in the middle 70s. And for the last couple of months of his life, he was in a hospital room on morphine, darkened. And that was the only way he could really exist those last couple of months. And the whole time he was in the hospital for his last part of his illness, Aunt Margaret would say, you know, there's got to be a better way to do this. And Pete died when he was 30, and Aunt Margaret began gathering volunteers for hospice and working on training for hospice volunteers.
When I stop and think about the differences between what they were dealing with and what we're dealing with, I don't think there's that much difference in terms of patient care. Our core services are the same, and I think the needs and the desires of the patients are still the same. Everyone wants to be under good pain control and symptom management. They want to have the best quality of life as possible.
I think what's important is a lot of times we got the misconception of what hospice is all about, and we think in terms of just death, but we don't see all the good things, the benefits, the things that can be done. And it doesn't necessarily mean you're dying when hospice is called in, because there have been some that look like turn the hands of the clock back for a while. What's impressed me is all of the good things hospice has to offer, how that they can come in, what they can do, how they can get social worker set up for you, how that if you need to go to the store, maybe one of the family members needs to get out for just a little while, how they can come in and maybe have someone to sit, or maybe if someone just needs their hair washed, that they would do that for them.
I learned very quickly the tremendous impact that all the disciplines bring to the table. It's a team approach, and everybody looks at patient care differently. Everybody will notice different needs. So I'd say not just one discipline stands out to me. What really stood out to me was the importance of all the disciplines and everything they bring to the table to provide the very, very best care for patients and families.
Tell me what Aunt Margaret would think if she could see hospice.
Oh, she would be bursting with pride. She would be so excited. She got real excited all the time, and she smiled and she bubbled, and she would be so excited that hospice has turned into the wonderful organization it is, that it's helping so many people. She would just be out of her mind with happiness over this. It would be great. I'd love to see that.